For years, Joanne Lewis struggled to come up with enough money to buy the expensive prescription drugs she needed. Her blood pressure was dangerously high, and she had severe acid reflux and a heart problem. She needed more than $200 worth of medications every month, but she couldn't afford to pay for them. Then her doctor told her about the new $4 prescription programs that some pharmacies are offering their customers, and that changed her life. Now Miss Lewis is enjoying life and her family once again. She's also gaining back some of the weight she had lost. At one point, she weighed only 80 pounds. Now, she says her doctor calls her fatty.
I got 5 kids and they around here thinking they mama about to go because they couldn't afford it for the little purple pill they put me on. It's like $180, and that's for the prescription. And I had it because acid reflux was getting me too. And they prescribed it, but I say, I can't. $180, that's like a house note. I couldn't afford my blood pressure medicine, so I was without it for a year. And my blood pressure was like 285 over 180. And they keep saying, why you ain't dead? And I say, because well, I'm supposed to be here.
The offering of deep discounted medications through a variety of places, Walmart, CVS, Walgreens, etc., provides access to medications that people otherwise might not have access to. So instead of writing a prescription and hoping that a person can get it either at the county hospital or at the health department or someplace else, there's a clearly defined mechanism by which you can advise somebody.
It went to no avail for the longest until this program came along. That's why I tell you, it's a lifesaver for me, you know, because I didn't have nothing, you know. Didn't have nothing, and now I smile. I enjoy life. I live it to the fullest because I know I'm taking care of myself in the way that I need to. So everything has been great for me. I'm not scared now when he say, well, I got 2 prescriptions for you this time. See, it's not frightening anymore because I can come up with that money to get it. So, oh, it's been all good for me.
To some extent, these discounted pharmaceuticals and now some discounted diabetic supplies is really the outline of how a healthcare system could evolve in ways that are different than we might have envisioned 5 years ago. Finding ways to provide access to care or health insurance for 47 million uninsured people is now on the public agenda again, and it may really alter the dynamic of how we think about providing fairly basic primary care services to large numbers of people. If you're talking $12 or $15 a month for 3 prescriptions, virtually everybody can afford that.
Some of the large chain stores are also offering simple diagnostics, such as testing for cholesterol, high blood pressure, and diabetes. This could further revolutionize patient treatment models.
There are technologic changes that may make it easier to deliver aspects of healthcare that traditionally require a physician. These types of outlines, if you will, could become models that are derived from a public health perspective that provide care to people who are traditionally uninsured, underinsured in a system that is non-traditional, but perhaps may be more effective and more efficient than what we currently have.
Dr. Michael Morrissey, a healthcare policy expert at UAB, says the $4 prescription model could provide new access to healthcare for people without health insurance.
Consumers need to know more about sort of the use of health services, what's appropriate, what isn't appropriate, when it's right to go to a retail provider of health services, and when you need to see a physician. As these retail outlets for routine services become more common, I think increasingly they're going to be staffed by nurse practitioners, physician's assistants, folks who are sort of well-trained to do a limited scope of practice.
A School of Public Health or investigators in School of Public Health would develop protocols, develop demonstration projects around these outlines that then become models to show that there are other ways to more effectively and efficiently deliver basic primary care services.
I know I would call my girlfriends. Look at here, you need a prescription filled? They got a $4 plan. And then that tells them, and they can share it with their families and friends. I know I told a lot of people. I told a lot of them, let's go. We can get it cheaper and we can afford it. So it worked out good. It worked out good for me. I am proud, you know, and I'm gaining weight.